Dr. Usman Waheed, he's a young trauma surgeon and he's a general surgeon. He has a very busy practice in Jersey Shore Medical Center. He was born, raised, and educated in America. So he is a first-hand United States trained physician. And his father is also a doctor. And I think, what is his specialty?
He's a pulmonologist.
Pulmonologist. He's a lung specialist. So he grew up and decided to come and live in our area. His children are coming to Islamic Center Fallbridge Academy School, and he's very happy and proud to be a member of our community. Actually, what if I recall correctly, he actually searched for the area before moving, and he took the job at the trauma center here in Jersey Shore. He looked for school and he liked our school. He and his wife are very actively involved, and he's really very motivated to help for the Parent-Teacher Association. Very well educated, very well balanced person, alhamdulillah, and he's trying to do something more. I don't know whether he allow me to disclose that or not, that you're trying to do that new thing. Not yet, okay. All right, so we'll not talk about that. So I will give to Dr. Usman Waheed, trauma surgeon. Before we go, if you have any emergency, you go to Jersey Shore, you call for his name.
Assalamu alaikum wa rahmatullahi wa barakatuh. رب اشرح لي صدري ويسر لي امري واحلل عقدة من لساني يفقهوا قولي. Today I'm going to talk to all of us about a topic that I see, as Dr. Farouk you mentioned. I see this topic a lot, and I see it affect a lot of people. That's pediatric trauma. It's something that we hope we don't see in our own kids. We hope we don't see it in our loved ones. But unfortunately, it's a fact of life that it happens. And it can be very devastating to people. It can be devastating to families. So that's why I'm going to take a few minutes of your morning, this is at your afternoon, to talk about some of the things that we can do to prevent that. And we'll begin the conversation talking about why this is important. So pediatric trauma is the #1 killer of children after the neonatal period. Half of the injuries result from motor vehicle crashes and collisions. Traumatic injuries often involve blunt trauma to the head. This is the most common kind of injury in kids. And that's because of their disproportionately large head size. And that's something we'll get into the sort of the physiology of kids and how they're different from adults, and how the traumatic injuries are also a little bit different from adults. Before I go on, I will add that the presentation towards the end, there's a couple of graphic pictures. If you guys have issues with that, you may want to get behind the curtain or something. So again, drowning is a leading cause of death for the young, very young, the less than 4. Pedestrian versus vehicle is a leading cause of death for kids 5 to 9. Injuries or traumatic injuries, as this talk is titled, can result from anything, any kind of change in acceleration injuries, deceleration injuries, collision injuries. These are the most common kinds of blunt injury. We're not going to talk too much today about penetrating injury. Alhamdulillah, we don't have too much in the way of gunshot wounds and knife wounds and that sort of thing in this area. With our kids especially. So that's a topic that I'm going to leave for a different day. We're going to talk primarily and basically only about blunt injuries, and those kinds of things are mostly from motorized vehicles, falls, bicycle sports. So this affects 22 million kids a year. 1 in 4 out of those 22 million kids who are involved in trauma are going to suffer from a serious injury. And this is another important thing, that more children die from trauma than all other causes combined. Unfortunately, this is our kids. Sometimes we vaccinate them, as the speakers before me talked about. We protect them from all kinds of other influences, but the trauma is something that we just, unfortunately, we don't have a really good handle on. So now let's talk about sort of the physiology of these kids and what makes them a little bit different from a trauma perspective. So we'll break them down into these 4 groups: the neonatal group, the infant group, toddler, preschooler, school-aged, and adolescent. So the infant group, and this is the group that is very, very young. These guys have rapid growth. They have fear of separation and strangers, and they explore things by the mouth. This is the group that we're talking about. And what makes them different is that these guys are obligate nose breathers. When any of these children have the symptoms that we talked about before, as far as flu and cold and whatnot, they really have problems because their nasal passageways often get obstructed and they really have difficulty breathing. They also use their abdominal muscles to breathe. They have increased metabolic rate. That means that they need to eat all the time. And their circulating blood volume is a little bit more than everybody else's. Their primary reflexes are present, and they have a very immature nervous system. These are the differences, again, between these the very, very small individuals and adults. The toddler group are characterized by rapid growth. They're curious. They want to be autonomous. They fear separation. And physiologically, their ribs are more horizontal than rounded. Their bones are not calcified. This is significant because in blunt trauma cases, if they're in some sort of accident or they're struck by a car, for example, you can have a lot of resultant injury to the underlying organs without having a break in the ribs or in the bony skeleton, which is there for our protection. Also, as I mentioned before, their head is proportionally larger and heavier than the torso, and their neck muscles are relatively weaker. The other important thing to recognize is that they have a more thin, pliable cranium. The skull cavity, which protects the brain, is a little bit weaker. So, for example, if you have a child, and I've had a few of these recently, that have fallen from couches from various heights and land on their head, they will, on occasion, develop brain injury or mild brain injury from that. Preschoolers. These guys are more magical thinkers. They lack a concept of time, and those of you who have preschoolers will confirm that. Interpret words literally. Then they, like the rest of us, fear pain and darkness. So for these guys, the head is becoming more proportional to the rest of the body. Their bones are still relatively thin. Their chest circumference is now becoming larger than the head, though they still appear top-heavy. Their abdomen tends to protrude, and their back is swayed. So, with these guys, the reason why that is because their abdominal cavity is small relative to their larger organs. Their liver is starting to grow, the other things are starting to grow, so that you might notice that your child, or you might have a little bit of a belly. So that's this preschool age. So once they get to the school age, these kids are more logical, though some of the parents here might debate that with me. They have a better concept of time. They tend to hide their feelings somewhat. They exhibit a little bit more risk-taking behaviors. And as a rule, these are the kids, they like to do things like help out. Now we're getting into kids who have more adult-like body proportions. Their head size is now about as big as it's going to be. Their body may appear lanky, secondary to growth. From a trauma perspective, things that we need to know is that the kids that are a little bit younger than 10 have a narrow portion of their airway just below the vocal cords. This is important for trauma to the head, trauma to the chest, because oftentimes we have to, as trauma surgeons or those of us involved in the emergency care, have to stabilize these patients, and part of that is protecting their airway and helping them breathe. So this is part of that. The larynx is anterior. This is important also because the larynx is the voice box and the entryway to the breathing area, and that's important to know because of the placement of these instruments that we use to help these kids when they're really in trouble. Adolescents. These guys are 16 years old, 15 years old. They're not adults, but they've got these tendencies to be experimentative. They've got a very strong body image, tend to be more risk-taking, they seek independence. Peers are very, very important to them. They experience mood swings, and they have a lot of the common fears. So from them, the thing to note is that these guys will have dramatic changes in physical maturity. So sometimes they will appear very, very physically mature, even though they're emotionally and mentally immature. They have rapid growth spurts. This is characterized by the onset of menses in females, and their body is more adult-like in proportions. Basically, when we get a trauma from someone that's of that age, physiologically there's not a lot of difference, but psychologically there can be differences that we have to address. Okay, so now what's normal? And this is something just to be aware of, because you may be taking care of your kid. Say he's God forbid, has gotten hurt, taking care of someone else has gotten hurt. Things to know that what is normal, what is not. For an infant, that first group that we talked about, their heart rate is 100, can go from 100 to 160. If any of us' heart rate was 160, we would be unconscious. Their respiratory rate, 30 to 60. If any of us' respiratory rate was 60, again, we would be unconscious. Their blood pressure, which is, as a rule of thumb, measured as 70 millimeters of mercury plus twice the age. So let's just say this is a 1-year-old. That would be 72. If your systolic blood pressure was 72, you would be unconscious. So these kids that live at this is normal for them. For many of us, this is not something that can sustain our life. So it's really kind of amazing. So as we move on, you can see the toddler's heart rate is from 90 to 150, and moving on, the heart rate tends to get a little bit slower as we get a little bit older. Similarly with the respiratory rate. So this is what's a normal thing for your or anybody else's child. So what are red flags? Things to look out for. And these are things that are not directly related to trauma, but things that if you see these kind of things in your child, they're definitely things to take to the emergency room for medical attention. If you notice that your child is having, or a child is having seizures or jerky-like movements with their arms or legs that are involuntary, if you notice that your child is blue, or that they have a fever with a rash, any kind of mottling of the skin, if their heart rate is greater than 180, that's kind of that's a very bad problem, regardless of how old the child is. Pallor is sort of a subjective paleness of the skin. If you notice that in your child, that's something that you need to seek medical attention for. Respiratory rate greater than 60. This is greater than 60. This is 60 times per minute. Okay, so if you notice that your child is breathing faster than 60 times per minute, that's something you need to seek medical attention for. If you've got a bleeding that's not controllable, of course you need to take them to the emergency department. Respiratory distress, if you notice that your child is having difficulty breathing, that's something to address. Significant trauma, and this is what we're going to talk a little bit more about. Nasal flaring, this is mostly in the very, very young, but maybe in the toddlers as well. If you notice that their nares are getting very big as they're trying to take deep breaths, that's a bad sign. And any time that you notice that their behavior is different and that they become more, if they had any changes in their mentation, that's something that you should really address right away. And this is what I mentioned earlier as far as uncorrected noisy respiration. If you noted that when your child is breathing, that they're having they're making a lot of noise when they take every breath, that's something that you need to address with the emergency department. So this is getting back to the trauma, which is a little bit more on topic of what I was asked to talk about. So this is a blunt trauma. This is something that we see quite often in the trauma department. We see the child is riding on their bike, and you can see that this young man has hit a rock with the bike. And I want you to notice a couple of different things. The one thing that we often get is the handlebars going into the belly, and the head hitting the ground. So a lot of times we'll have these kids with these kinds of injuries, and we may have to evaluate them for injury to their abdominal organ, because their abdomen is packed with large organs in the small abdominal cavity, as well as a concussion or some sort of mild head trauma. So, as I mentioned before, there are three main types of blunt trauma: acceleration forces, deceleration forces, and crushing injuries. And a lot of times this happens as a combination. As what we just saw on that last slide, there was the acceleration force of being on the bike and going up and landing on the ground, the deceleration force of the sudden stop when the